Hi, now we will read about viral rhinitis, common cold. The term common cold often is used when referring to an upper respiratory tract infection that itself limited and caused by a viral, that is viral rhinitis. Nasal congestion, rhinorrhea, sneezing, sore throat, and general malaise characterize it. Specifically, the term cold refers to an afebrile, infectious, acute inflammation of the mucous membranes of the nasal cavity. More broadly, the term refers to an acute respiratory tract infection, whereas terms such as rhinitis, pharyngitis, and laryngitis distinguish the sites of the symptoms. It can also be used when the causative virus is influenza, the flu. Colds are highly contagious because virus is shed for about 2 days before the symptoms appear and during the first part of the symptomatic phase. The 6 viruses known to produce the signs and symptoms of the viral rhinitis are rhinovirus, parainfluenza virus, coronavirus, respiratory syncytial virus, influenza virus, and adenovirus. Each virus have many multiple strains. Clinical manifestations. Signs and symptoms of viral rhinitis are nasal congestion, runny nose, sneezing, nasal discharge, nasal itchiness, tearing watery eyes and scratchy eyes, sore throat, general malaise, low grade fever, chills, and often headache and muscle aches. As the illness progresses, cough usually appears. In some people, viral rhinitis exacerbates the herpes simplex, commonly called as cold sore, that is near the lips. The symptoms last from 1 to 2 weeks. Medical management. There is no specific treatment for the common cold or influenza. Management consists of symptomatic therapy. Some measures include providing adequate fluid intake, encouraging rest, preventing chilling, increasing intake of vitamin C, and using expectorants as needed. Warm saltwater gargles soothe the sore throat, and non-steroidal anti-inflammatory agents such as aspirin and ibuprofen relieve the aches, pains, and fever in adults. Antihistamines are used to relieve sneezing, rhinorrhea, and nasal congestion. Topical nasal decongestant agents may be relieve nasal congestion, but if they are overused, they may create a rebound congestion that may be worse than the original symptoms. Some research suggests that zinc lozenges may reduce the duration of cold symptoms if taken within the first 24 hours of onset. Nursing management. We have to teach the patient for self-care. Most viruses can be transmitted in several ways: direct contact with the infected secretions, inhalation of large particles that land on the mucosal surface from coughing or sneezing, or inhalation of small particles, aerosol, that may be suspended in the air for up to 1 hour. It is important to teach the patient how to break the chain of infection. Hand washing remains the most effective measure to prevent transmission of organism. Also, the nurse teaches the patient to treat the symptoms of the common cold, and the preventive measures are perform hand hygiene often, use disposable tissues, avoid crowds during the flu season, avoid individuals with colds and respiratory infections, obtain influenza vaccination if recommended, eat a nutritious diet, get plenty of rest and sleep, avoid stress, exercise properly, practice adequate oral hygiene, avoid smoking, avoid allergens, and gargle with salt water, increase fluid intake, particularly of hot liquids, and provide warm, moist air, shower, avoid irritants, dust, chemicals, tobacco smoke, etc. Thank you.